Hello everyone, welcome to Gyan's Academy. In today's video, we are going to see cardiomyopathy. Before moving to today's topic, I would like to request please like, share and subscribe our channel on various platforms. And please subscribe for daily NCLEX practice question. So you will be getting a daily question in your email. So let's move on to today's topic, that's a cardiomyopathy. What is cardiomyopathy? Cardiomyopathy is a heart muscle disease where the heart muscles becomes weakened, enlarged and stiff. This affects ability to pump blood effectively. There are three types of cardiomyopathy. First one is dilated cardiomyopathy, also called as a DCM. The heart chambers become enlarged and weakened, leading to a decreased ability to pump effectively. This can result in a symptoms like fatigue, shortness of breath, swelling in the legs and an irregular heartbeat. Second one is a hypertrophic cardiomyopathy. HCM is a characterized by abnormal thickening of the heart muscles, especially in the left ventricles. This thickening can obstruct blood flow out of the heart and leads to symptoms such as chest pain, shortness of the breath, fainting and palpitation. Third type of cardiomyopathy is restrictive cardiomyopathy. RCM involves stiffening of the heart muscles, which restricts the ability to feel the blood properly during the relaxation phase of the heartbeat. This can cause symptoms like fatigue, fluid buildup in legs and abdomen, and difficulty in breathing. Now let's see causes of cardiomyopathy. Remember, cardio. C stands for congenital heart disease. Maybe it's due to genetic factor. A, alcohol abuse or drug uses, especially cocaine or amphetamines. R, rheumatic fever causing a damage to the heart valves. D, diabetes or other metabolic disorders. Infections like viral infection or bacterial myocarditis can cause the cardiomyopathy. O, obesity and overweight, which are the contributory factor for hypertension and strain to the heart. Sign and symptoms of cardiomyopathy. Remember, heart pains. Heart palpitation, patient will have the irregular heartbeat. Edema will be on the legs and ankles and on abdomen. Arrhythmias, abnormal heart rhythms will be there. Reduced exercise tolerance, that means patient will have the fatigue or shortness of the breath whenever they are having any exertion. Tachycardia, rapid heart rate will be there. Pain or discomfort in the chest, patient will have the inguinal pain. Ascites, fluid accumulation in a peritoneal cavity will be there. Irregular heart sounds, murmurs or extra heart sound can be heard. Patient will have the nausea and dizziness. Shortness of the breath, especially when lying down, and patient may have the orthopnea. Management of cardiomyopathy. Remember, healing heart. Heart healthy diet, low salt and balanced nutrition, exercise regularly under the medical supervision, ACE inhibitor or ARBs to manage the hypertension and heart failure, lifestyle modification, smoking cessation will be there, stress management will be there, implantable devices like pacemaker or defibrillator, nitrates and nitroglycerin for the chest pain management, genetic counseling and testing for inherited forms of cardiomyopathy, heart transplant if medical management fails, echocardiogram to monitor regular heart function of the client, anticoagulant if patient is on a risk of blood clot, reduce alcohol or drug uses, treat underlying conditions such as diabetes mellitus and hypertension. You can visualize healing heart as a comprehensive approach to manage cardiomyopathy encompassing lifestyle changes, medications and medical intervention. Thanks for watching. Don't forget to practice questions on cardiomyopathy. To practice, visit www.perfectprofessionals.co.in or scan QR code. Thanks for watching. Bye bye for now.